Hello everyone, I'm Dr. Francisco. Welcome to the bite-sized information for kidney and related conditions. This video blog is destined to help patients, other relatives, to be better informed about their kidney condition so they can manage the disease better, they can understand it better, come into better terms with it, they can have more meaningful discussions with their own doctor, and take the best possible decisions in their management, what can minimize complications and worries. Sorry, my glasses are a little bit. Sorry. Okay, so let's start. Today we're going to talk about how to prevent protein wastage and malnutrition of chronic kidney disease. The best way to prevent protein wastage and malnutrition of chronic kidney disease is following a balanced and healthy diet according to the metabolic needs of the patient, the stage of the disease, and the restrictions that need to be implemented to correct ongoing and future metabolic problems. A healthy and balanced diet, not greatly different from that diet of healthy people, is typically recommended to patients with chronic kidney disease in early and intermediate stages, for example, stages 1 to 3A. Ideally, patients should avoid high sugary foods and drinks, fatty, oily, and fried foods, salty dishes, and processed foods. And actually, healthy people should avoid the same. For patients at more advanced stages, let's say stage 3B to 5, or with total kidney failure, more dietary restrictions are recommended. Sodium and salt intake should be moderated around 2 grams of sodium per day, which equals to around 5 grams of salt per day. Also, the potassium, the phosphorus, and the calcium, both in the diet and on prescribed supplements, and protein are restricted in many patients. The type and extent of the restrictions need to be individualized to the patient's general nutritional status, the stage of the chronic kidney disease, because usually the restrictions are recommended from stage 3B, but some patients need a little bit earlier, like stage 3A. Also need to be adjusted to patient symptoms, accompanying diseases, and laboratory parameters. Typically, a restriction of 0.8 grams of protein per kilogram of body weight per day is recommended in stages 3A to 3B and 4 of chronic kidney disease. There are other recommendations, but around that figure, depending on the different guidelines, different countries. Yeah. The aim of restricting protein is to slow down the progression of kidney disease, to diminish the amount of protein-derived toxins in the blood, and therefore the symptoms derived from those toxins, the building up of those toxins, and to reduce also the load of phosphorus containing proteins and the consequences of its excess. Occasionally, doctors can prescribe a higher degree of protein, and if this is necessary, supplementation with special amino acids called keto acids is recommended. However, taking keto acids when protein restriction is not very high, so meaning not very restrictive, does not add any significant benefit to the patient and add to the unnecessary cost. If you restrict your protein, then probably you need a little bit of supplementation with these keto acids. But it's more like a supplementation when you are restricting, but not like it's something like add itself some benefits. If you are not restricting protein, it doesn't give you extra benefits, but will give you extra cost. It is important to mention that very restricted protein and phosphorus diets contribute also to malnutrition. Plus, that adding to that negative effect of nutrition that progressive kidney disease has, no? So a balance must be struck, but this balance is difficult in many circumstances. Following the advice of a clinical dietitian with expertise and experience treating renal conditions can help you strike better balance for obtaining the best possible nourishment and for avoiding malnutrition. Also to translate what this restriction 0.8 grams per kilogram per day will mean to you. What that means. So they will translate that into some dietary advice, a diet plan, etc. And they try to also, the restrictions compensate with other aspects of your diet to give you or try to maintain nutrition as best as possible. Sometimes patients must be prescribed oral supplements and shakes to boost that nutrition because indeed the diet is a little bit too restrictive, or because the disease, the nutrition is not picking up. But a proper assessment by dietitian is necessary, taking into account all the factors I already mentioned, so to try to move the patient's health to the next level. Diet is crucial for patients with renal disease. That's not a question, that's not, everyone know it, and also diet is the source of many of the problems of kidney patients. So not following the diet, not following the restrictions, or overdoing the diet, having some excesses, like going to overweight, etc. But diet is also very important for everyone, no? But more for people who has got a medical condition to take care of. But because diet is something believed as common, simple, and mundane, many patients relegate it, don't do the necessary changes, and as a consequence, silently, the field for complications is being brewed. And that's what I want to avoid through, giving you these pieces of advice. Is what I do in my clinic, Francisco Medical Center. So I just want to remind you that these topics and other all the topics that we have discussed in this video blog are included in my new ebook. So you can download it and get hold of this information in a readable fashion if you like to hear it. If sometimes I talk too fast, or you can just read it in there as a complement to this information. And remember, this is only one part of your care, giving you information. Be better informed. You still need to discuss all these with your own doctor or with me if you choose me, and also with professionals like dietitians. We have people, medical social workers, etc., nurses, etc. So if you have any question, you can leave it in the comment section. If there is none now, I can reply it later if you watch on the replay. And if you like this, please give me a like. So that's my motivation. I really encourage you to follow this, not just because I'm doing it. I'm doing it because I believe, I'm convinced it's useful. And after I published this ebook, I have received very good comments from people in Singapore, Indonesia, Mexico, Malaysia, even the medical director of the National Kidney Foundation Singapore congratulated me, and we have a discussion about this. So so it seems to be that people, it can be useful. So don't just leave the link alone there. Just link it or share it with someone. If you already know it, it's good. If you have very good discussions with your own doctor, it's good. But might be someone that maybe needs that help. Maybe in some places of the world, or some busy clinics, people don't have the time to explain all this in more detail. So initiatives like this can be powerful to do that, especially when it's free. So because my aim is just to help as many people as I can. Now, for people who really want my professional, personalized, individualized advice, they need to, obviously, they can contact me professionally. But for me, there's no harm. On the contrary, a lot of benefit that I can just, whatever I know in all this general knowledge, I can just bombard you in videos, in blogs, check my website and in this ebook. So if you like it, also share it with your colleagues, friends, loved ones. Is mainly destined for patients and caregivers, but also can help nurses, rehab people, pharmacies, you know, dietitians, other healthcare professionals that want to know more about, or dialysis technicians, you know, I want to know a little more about what, what this means, or um, what actually the patients can be suffering or struggling. It's comprehensive. It's incomplete because there are many more topics I want to add in the future, like nephritis, persistence, etc. But is at this moment talks about the main things: chronic kidney disease, transplantation, dialysis, answers many common questions asked by real patients, no, that have asked me um, either in my clinic, my everyday practice, or they have asked me through some of the platforms I've been a consultant or an advisor, and so it's not uh, it's not a textbook. So the fact that it's a Q&A format is a little more impactful, because you can just search what is the topic of your concern. And also, if you have any question that maybe in the future I can add, you can put in the comments. So I'm Dr. Francisco, wishing you the best possible health.